Right. Good day, ladies and gentlemen. I apologize for the recording, but I was invited um, to present a presentation for concussion and neuroscience. It was a last minute request for a rugby team. Um, so um, there will be a recording for today. Now, please excuse me for that. If you do have any questions, as always, I always encourage you to please let's first approach your tutors, engage with them, make sure that you have first gone through the material. Please, guys, it is very important that before you ask a question to make the tutor's job easier, that you have already consulted your textbook, that you have already consulted um, the content at which you are asking a question about. It just helps make that conversation flow a lot easier, as well as it also enables you to understand the topic more. So please, if you do have any questions, please do ask your tutors. If you do have any questions regarding the lecture, please do ask me and I will always assist wherever possible. But yeah, if you guys want to grab yourself a cup of coffee or a cup of tea, as we always do before we start, um, please do so. And when you are ready, then of course you can continue listening to the recording. Now, today we're going to be doing assessment and programming. Now, what we're going to be going through today, we'll get to now, but mainly it's going to be your screening and resting assessments, your testing. So you're looking at your fitness, endurance, strength, power, speed, and then the components of exercise programs. Now, what is really important to understand here, guys, is when you're looking at this and you're looking at heart rate, or you're looking at blood pressure, you're looking at posture, body composition, etc. Do not generalize. Okay? Do not generalize. But probably the most important thing is when you're doing testing, make sure that your client feels comfortable. That is the utmost importance, that your client feels comfortable. For some of the testing, if you are working with a female specifically, please be aware of your surroundings. What I mean by that, when you come to doing some of these tests, if you are going to do them, it is incredibly important that privacy is taken into account. And if the lady is required to remove her jacket or whatever the case may be, please, if they would prefer to be in a more private space, please do so. And always make sure that there is consent before you do any of these tests. If they do not want to do a test, they do not have to. It is not compulsory. We are merely just looking at various different health measurables that we can look at to quantify their performance, to quantify where they are, and then to where we want to go. Why? So that we can have incremental measurements that we can take on a monthly, a weekly basis, for argument's sake, to make sure that there's an element of progression. So if it is not compulsory, if they do not want to, they do not have to. But please, let's be um, um, open and let's be sure to ensure that um, that the client feels that they have been well looked after. Now, when we start to think about it, we think of a lot of these things like a heart rate and a blood pressure, and I don't really think it is taught enough in health science, in medical science, and in training where how important these variables are. Because if you look at overall health, a large portion of it, be it getting sick with the normal common cold or flu, whatever the case may be, stems from these variables moving out of the normal ranges. For example, if you look at heart rate or blood pressure, right? A lot of the time you can start to notice a change in health when these variables start to fluctuate, either increase or decrease. Now, when you look at that, by no means are you now a doctor, and by no means are you telling people that they have X condition, Y condition, or whatever the case may be. But what you are going to do is be able to say to them, hey, look, your blood pressure has increased, your blood pressure has decreased. If I was you, maybe I would perhaps seek more medical assistance. Or if you're looking at it from a training point of view, you can start to see with regards to strength training, endurance, or working with high performance athletes, how those variables fluctuate throughout a training protocol, throughout a training session, or whatever the case may be, to gauge what you are trying to get out of that athlete as a trainer. So that is also very important to take into account. Now, when we're looking at some of the testing and that we're going to go through, um, when you look at some of the testing with regards to fitness, endurance, strength, power, speed, flexibility, and agility, it is also important to know that you do not have to do every single test, guys. You do not have to do every single test. Why? Well, when we look at the assessment and programming, a lot of these screening and resting assessments and testing, you are probably going to be doing in your initial consultation with your client or clients. Now, what does that mean? Well, normally, you can charge for those. Can be a charge session, but some trainers like to offer it as a free session of goodwill. Now, that is not to say that now everyone has to give it as a pro bono or you have to do it for free. No one is saying that at all. But sometimes it is a nice thing to be like, well, you know what, here, before we start, we're going to take some measurements, know where you're at, so then you can construct and design a training program for your client that is going to meet their current health requirements as well as capabilities. For example, if you're noticing with very different testing, this person wants to become an Olympic sprinter, for argument's sake. But you see with regards to their posture, their body composition, and the various different tests that you've done, that they need to start at a certain point. And then you can progress to where they need to be. Maybe they are further along and they are right there and they need just a couple of tweaks and whatever the case may be. Or maybe they're further back and they require further development to get to the stage of high performance that that client or athlete so requires. Now, when you look at that, it is important, as I said in the beginning, to not generalize. Just because someone may test well does not mean that that testing result will transfer to performance within your training protocol. And that is why it is also important that you keep your finger on the pulse, so to speak, and you keep an eye on their overall progression. Don't be like, well, this person's like the next Usain Bolt. My hands are clean. I'm going to give them a protocol, and off we go to the Olympics. No, be very specific and arguably even anal when it comes to looking at these various different things, and be proud of the work that you are doing. Be specific and look at it. Everything has a reason. So when you're looking at training protocols, when you look at the responses from it, why? Keep asking yourself why. If they have high blood pressure, why? What are the questions that you're asking that may lead to this high blood pressure? Did they slam a monster in the car before coming in to get that testing, for argument's sake? Or is it a recurring issue? What is their stress like currently? Now we're not trying to play Dr. Phil here and let's play 21 questions and let's dig into their psychology and how they are as an individual, right? That is not our place, but you can ask certain questions that, generalized questions, right? But, you gauge this with your clients. Of course, you probably will develop a personal relationship with them as you develop this relationship with your client, but, use common sense, right? And try and negate your way through those different testings. So you get the point. Like this is the building block. Before we get to the periodization, before we get to the anatomy and physiology, before we get to building and then looking at the special considerations, etc., the nutrition, the psychology, all of that around it. You have to first see where your client is, right? You have to know where they are and then where you want to go. And then, like I said, you now have these variables which can be your checkpoints along the way. Because if you don't check, if you don't measure, how do you know that what you're doing is correct, right? And then how do you know where to push, where to pull back, and get the overall best performance of your athlete? Okay, so let's start. Now, here we're going to be looking at heart rate. Now, when we're looking at the heart rate, we're looking at the beats um, per minute of the heart. You're going to then have your blood pressure, posture, and body composition. Now, heart rate specifically, before you measure the resting heart rate, your client should rest for 5 to 10 minutes in a supine or seated position. The following are pointers for accurate heart rate readings. So, for example, resting heart rate may be measured directly by placing the fingertips on a pulse site, so the palpitation, or directly by listening through a stethoscope, also known as oscillation. Now, resting heart rate should be taken first thing in the morning. This should be done when the individual is sitting, not lying down, on 3 consecutive days, and an average reading should be thus obtained. The resting heart rate may be taken for a full minute or for 30 seconds, and the reading multiplied by 2. So when you're looking at the heart rate, right? When you start using your stethoscope and the blood pressure cuff or whatever the case may be, but in this case, the heart rate, and you're trying to gauge what it is, or maybe using your finger, you're doing the test or whatever the case may be, um, use a number there that you can think of. So either set a timer on your phone, for example, for 15 seconds, and you can feel the pulse and you count 1, 2, 3. And then you look at the clock, and your alarm will be like, it will ring, because you've set a 15-second timer or whatever the case may be. And then you multiply that by 4, or like they said here, 30. But often you'll end up getting incorrect readings, or becoming quite repetitive with it, when for example, you're trying to measure the pulse, and you're measuring the pulse, and you counting the pulse, but you're also counting the seconds, and you're trying to remember, okay, I counted 30 seconds, but what was the pulse? Was the pulse 30 as well? Was it 40? Was it 20? Where um, did I lose count? Or was the pulse 30, but I counted to 40? So then if I counted to 40, then that is 2/3 of 60. So 40, and now all of a sudden you've lost the plot already. And it just creates, you want to be efficient, because when you do this testing, let's say you give a session, you only have half an hour to an hour, right? Let's just say an hour. So of these tests, you want to get them in, out, before you start getting to the other testings, the fitness, endurance, the speed, and that, whereby you're going to have to set up gym equipment, you're going to have to set up whatever um, drill you want them to do to get the answers to the test that you're trying to test for. So it is really important that you practice, 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 right? Practice on your mom, practice on your dad, practice on family members, friends, you name it. Tell them, hey, look, when else did you check your heart rate? Gee, I don't know. Come, let me test. And you just keep practicing and practicing. That is the only way that you're going to get better. That is the only way that you are going to be able to streamline your skill set, to be able to do it a lot better. Heart rate. So your resting heart rate is accurately measured by placing the fingertips of the index and middle finger over the radial artery of the wrist. So you can do it on your wrist if you want to. Exercise heart rate is most accurately measured by applying light pressure to the carotid artery. Why the carotid artery? Because your baroreceptors in the carotid artery respond to pressure by slowing the heart rate. Exercise heart rate should be taken for 10 seconds, with the first count being 0. Right, so 0, 1, 2, 3. When measuring exercise heart rate by oscillation, so using the stethoscope, the bell of the stethoscope should be placed over the third intercostal space to the left of the sternum. Another method of measuring heart rate is by the means of a portable heart rate monitor. This consists of electrodes which are strapped to the chest, which pick up the heartbeat and transmit it to a digital receiver. Now, out of these, the most quickest and most efficient one is probably going to be the stethoscope. Plug it in, doof doof, 1, 2. Okay, you look at your one, and you, okay. But If you do not have a stethoscope or you forgot at home or whatever the case may be, then of course you want to use your index and your middle finger. Please don't use your thumb. Don't do the ring method where you try and, put it around there. Your thumb also has a pulse of its own. So just use the two fingers or the stethoscope. If you do have the money to get a portable heart rate monitor, then by all means you can. But again, you want to use what's effective, what is the most mobile, and what is the best transfer of service to your client. Okay. So please practice this. Um, Very easy. You can do it on your own and get better with it. Now, if we look at blood pressure, so your blood pressure and the routine method of measuring blood pressure um, is very important. Now, blood pressure, there's a lot of indication then that you get from blood pressure with regards to performance. Are you hypertensive or are you hypotensive? Um, and what really isn't interesting with blood pressure is there's a lot of variables which can influence blood pressure. But like anything, especially high blood pressure or hypertension, over a long period of time, it can really cause physiological strain, and that physiological strain can carry over to various different health causation, etc., etc., um, and could result in long-term medication or long-term damage. So please do not underestimate the importance and the value behind blood pressure. Now, blood pressure is created in the arteries when the heart pumps blood to the body. Blood pressure is measured in millimeters of mercury, and systolic pressure, which is the upper reading, systolic, represents the pressure created in the blood vessels as the heart contracts. This is the maximum pressure created by the heart during a complete cardiac cycle. Diastolic pressure, on the other hand, which is the lower reading, so at the bottom, represents the pressure remaining in the arteries between contractions. So this is during the filling phase of the cardiac cycle, and this is the minimum pressure within the arteries during a complete cardiac cycle. So it's also very important to think of when you think of it when it comes to blood pressure um, and how it functions and how we function as individuals. Um, but that big number, the top number will always be bigger than the small number. The stereotypical normal blood pressure being 120 over 80 millimeters of mercury. And when you think of that, the bigger number has to be the top one. Why? Well, because if that's the pressure going to your whole body out of your aorta, you're going to need that pressure to reach your toes. You're going to need that pressure to reach your fingers, your brain, etc. And we know how important blood is. The transport of oxygen, nutrients, metabolites, um, the cleansing of the body, etc., etc., etc. But specifically, oxygen and nutrients, very, 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 very important. And if that pressure is not sufficient enough, what is the net result? But also, if that pressure is too much, what is the net result on a heart tissue, heart muscle, but also the subsequent organs that blood is going to? You know, are they able to receive the blood at such a high pressure? If what is that effect over a long period of time, etc., etc. And you really need to think about that. When you're thinking of people who do have high blood pressure, you're now thinking about training. If they say they've had it for a long period of time, what is that carryover going to be, and how can we lower that pressure to a manageable rate as soon as possible? What is affecting that pressure? Is it life? Is it life choices? Is it work? Is it stress? Is it food? What are the triggers for that increase in high blood pressure? So that we can negate and take as much strain, sorry, off of the cardiac cycle possible. Now, blood pressure of 120 over 80 millimeters of mercury is considered normal, as I previously mentioned. The systolic hypertension is diagnosed, so the bigger number, when systolic measurements is 140 millimeters mercury or greater on 2 or more separate occasions. So you're going to measure them the first time, and if that's a little bit high, you're going to be like, okay, cool, let's measure next week again. You measure next week again, it's still high. Well, yeah, there you go. Or greater on 2 or more separate occasions. Similarly, diastolic hypertension is diagnosed when the diastolic blood measurement is equal or greater than 90 millimeters mercury on 2 or more separate occasions. So, you're looking at 140 and 90, where the baseline is 120 and 80. Now, the method or the gold standard of measuring blood pressure is the direct measurement of intra-arterial blood pressure, right? In the field setting, however, blood pressure is typically measured indirectly by oscillation using a stethoscope and a sphygmomanometer. Now, this is consisting of a blood pressure cuff and the aneroid or mercury meter, right? So with that little bevel that reading instrument on it. Now, since stress can elevate blood pressure, measurements should be taken in quiet, comfortable surroundings to ensure a reasonable estimate of resting blood pressure. Clients should sit quietly for at least 5 minutes before his or her blood pressure is taken, and the client is seated, and the routine method for measuring blood pressure uses a sphygmomanometer and a stethoscope. The client's arm should be rested on a table so that it is level with the heart. Now, why do you do this? Because if you put the arm up, all that pressure is going to be coming down. It's going to build pressure, as well as if you're measuring all the way down here, there's just going to be, you want it kind of neutral to check where the in line with the heart, sorry, which is what is so important when you start to look at when you are measuring on this blood pressure. So you really do need to think about it in a over simplistic way. Now, when they say they need to sit quiet and whatnot, you need them to be relatively calm. Don't let them go onto their phone, because next minute a work email or phone call comes through, and even though they say, no, it's fine, I won't, let me do this first, etc., etc., all of a sudden, maybe they're a little bit worried, or they don't want to have the phone call, and all of these things you may not think affect blood pressure, but they will. And you're trying to get as accurate of a reading as possible. So we try to negate as much external influence as possible. Now, if you are doing this in a gym or whatever the case may be, you may require using one of the physio rooms or the biokinetics rooms or one of the consultation rooms. So please, if you are going to be doing this and you do require to book for that, please do so beforehand. Imagine if a client comes and you've planned this and now you're just wasting time, because now you're trying to find a place where you can measure them properly, and maybe you can't, now you need to delay it, etc., etc., etc. So please, let's use common sense and let's make sure that your clients are dealt with effectively. Right. Now, the process to measure blood pressure is the cuff of this device is placed around the arm above the level of the elbow. As air is pumped into the cuff, pressure is directed inward, compressing the brachial artery. A stethoscope is placed over the artery about 1 centimeter superior and medial to the antecubital fossa, and air is slowly released from the cuff. So all that is saying is that the stethoscope needs to be placed above the elbow and on the artery. So if you look at your elbow, you'll be able to see where that artery comes down. And when they say superior, they mean above, and then medial more towards the middle, and you can see that's where that artery comes through. At the point where the blood pressure exceeds the cuff pressure, the first sound is heard. This is the systolic pressure, and the sound is produced by the blood forcing open the compressed artery. As more air is released, the sound becomes fainter, and the diastolic pressure is read when the sounds disappear. So what this is here is really where, when you think about it, is when you get that lub dub. So you hear people say the blood pressure is measured with the lub dub sound, that doof 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 doof. So what you're going to do is when you put the blood pressure cuff on, you're going to pump it up as high as possible. Before you pump it up, please release all the pressure from the cuff so that you can get it on. Again, if you are going to use a cuff, if you are going to use it, whether you're using an electronic one from Dischem or Clicks, or you're using your own stethoscope and your own blood pressure cuff and you're doing it manually, please make sure that you take discretion into account. And what I mean by that is not everyone is going to use the same cuff size. Some people may require a slightly bigger cuff. Some people may require a slightly smaller cuff. Maybe you'll have a general size cuff. So please, if you are working, for example, with someone who is overweight, maybe they already feel insecure, or someone who is very small, maybe they already feel insecure. In general, maybe someone just feels insecure. Use common sense. If you're looking at it and you think it may be too big or too small, rather have it be too big than too small. But if it is too small, don't try and force it on. If you already notice that it's not going to fit, rather either say we'll do the blood pressure next time or whatever the case may be. Because you don't want them to feel that anxious. You want them to be as comfortable as possible. You don't want them to sit there and think, oh goodness. Then they feel awkward, you feel awkward, and you think it won't happen until it does. So please use common sense and just be aware of these various different situations. Now, going forward, when you increase the pressure of the cuff, you're going to increase, and it's going to feel quite tight, sorry, on your client's arm, and you want that, right? You want it to feel quite tight so that it can build up that pressure. And then you're going to slowly release the pressure. What I mean slowly is just open the valve a little bit so that the pressure can slowly come down so you can hear. Don't open it too much, whereby it just all the way and you're not going to hear anything. But don't open it too slow, and then you're going to be there for 5 minutes waiting for this to come back. So you want to open it to a point where it can move slow enough for you to see where the first tick is. And you'll see that tick. You don't necessarily have to, so it will start all the way and it will go, and then it will hopefully around 120, and then it will go, and then it will keep going, and then it will get to around 80, and then it won't do that again. It will just, you won't be able to hear anything. So, after the first doof doof, you'll hear doof 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 doof. Then you'll hear the last little, and then there won't be enough pressure left. So you just kind of look at that and where that's going to be, and that is how you get that diastolic and systolic, or rather systolic and then diastolic reading. So please be aware of that. Now, here you can see, let me try and use the laser. Hopefully everyone can see. So here's that reading, the sphygmometer, and then here's the cuff, there's the artery. I'm sure all of us have had this done by a doctor at some point. We can see on the inside what it looks like. If that's the cuff is going to inflate, and as that balloon inside inflates, it compresses, builds up pressure, and then if you look at the artery there, no pressure. Now there's pressure here, and then we measuring that flow through there to, and then press out. So you're checking that pressure. Now, if there is a discrepancy between readings taken from on different arms, it could indicate the existence of a circulatory problem. So, for example, if there's a difference, if you, for example, do the right or the left arm, there could be a circulatory problem. As the pressure is released, the so-called Korotkov sounds can be heard in distinct phases. The first sound signifies the beginning of the first phase and represents the systolic blood pressure reading. As the mercury continues to fall, the sound will change in quality to a louder, sharp tapping. This represents the second and third phases, which are of no particular significance. When measuring resting blood pressure, the fourth and fifth phases which involve the disappearance of the sound, usually coincide. Diastolic pressure is read when the sound disappears. However, during exercise, the fourth phase may be a muffling of sound representing the diastolic blood pressure. The fifth phase, the muffled sound, sometimes disappears shortly thereafter, but it may last until the pressure is completely released. So these are all just things that you need to take into account when doing it. And like I said, the only way that you're going to get better with this is through practice. That is genuinely the only way that you're going to get better, because if you do not practice, you're not going to be able to distinguish between what you think you are hearing and what you are actually hearing. Now, based on what we just went through there, you can see that here are the different phases. Let me just use my laser again. And here you can see all the different things. Here you can see the different phases. There's silence, you build up the pressure, you slowly release it. You have that first sound, which is the systolic pressure. You then have the phase 1, phase 2, phase 3, phase 4. Then you hear that last little doof doof. And then there's that silence, as I mentioned. So, if you can understand this graph, if you can understand this image, then you'll be on your way with regards to your blood pressure. So please think of that, and then make sure that you practice, please, please, please. All right, let's move on to posture. When we're looking at posture, right, very important. Why? When you look at posture, we are looking for imbalances, right? So you're looking for imbalances between top to bottom, left to right, front to back. Now, when you're looking at postural differences, you may think, okay, cool, yeah, but why this or why that? Well, the reason being is if you're going to give someone a training program, and there you can clearly see that there's a dominant to another side, and you just give a general training program, you're going to aggravate that one-sided dominance. You're going to okay, you're going to elevate um, that 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 dominance throughout the body, and it won't ever be in equilibrium. Now, in time, that could potentially lead to injuries. It could lead to muscular imbalances. It could lead to functional disabilities because one side has become too dominant. So you really do have to think of this, like I said, with an element of attention to detail. But now, when you're doing posture, now the best way is to probably to take photos. So please get consent before you take photos, please. More often than not, when you do take posture readings, you are going to probably have to ask your client to please wear tighter clothing. Why? So that you can get the silhouette of their body and their muscles so that you can see where the imbalances are or are not. Now, again, this is not now a license to get all personal, up close, etc. with your client. Please be respectful. And if you cannot do that, then don't do the test. If you cannot control yourself, don't do the test. But please be respectful and make sure that you get consent, right? If need be, and you need a colleague to be there with you just to make sure, whatever the case may be, do that if that's the case. But please make sure that your client feels comfortable and that they are protected in that sense. Now, when we do the different tests, don't tell them that okay, right, are you sure that's your posture? Because all of a sudden they're like, oh, and then they make it look like they are, you want them to be in as general of a stance as possible. If they generally sit with, or stand with their shoulders rounded, you want to see that. Granted, maybe now and again, maybe they might put their shoulders back because they're like, oh, damn it, I need to put my shoulders back. But if they genuinely are just rounded, and they have a form of kyphosis or lordosis, you want to see that. The same with their feet. Ask them to take off their shoes. If you notice that one foot has a slight tendency to lift the heel or whatever the case may be, you want to notice all of those different things. You want to notice if they are slightly slanted. You want to notice all of those things. You want to be able to have as an objective opinion as possible when it comes to doing the posture. Now, with the standard posture, so when assessing the standing posture, a plumb line is used as a reference, a standard against which deviations can be measured. And all this is, find somewhere where you are testing. If you're in a testing room or consult room, hopefully there's a tape measure on the wall or something like that, or a straight line. It can even be a building line or whatnot, or a door frame or whatever the case may be, something that almost gives you an element of true north, that you can have behind the individual, because if that's straight, you can divide the body into left and right when they turn, front and back, top and bottom, and you can almost be quite accurate with what you're seeing. And again, through using photos, and please make sure you get consent to take photos, which you then will be able to use. Now, if you do not have that, you can also use, for example, a plumbing line. Again, plumb line, so like a pipe or something like that. Majority of them should be quite accurate with being straight. So you use what you can, but ideally, if there is a door frame or a tape measure or a line that is intended for being straight, then of course use that. Do not just put them against a blank wall, because how can then you compare? Right? Granted, you'll probably be able to get a sense of their overall posture, but you really want to be as accurate as possible. Now, the feet are used as a standard fixed point when measuring standing posture with a plumb line. The point of reference must be at the base of the feet. When posture is viewed from the side, so the lateral view, the fixed reference point is slightly in front of the outer malleus. In the posterior view, the point is midway between the heels. A posture analysis is formed from an anterior, posterior, and both lateral views. Um, and some changes may be observed only from a particular view. For example, the clavicles can only be observed from the anterior view, whereas other changes can be confirmed by analyzing two views. So if the ASIS are level, the PSIS will likely be level 2. If they are not, one can check the ASIS again to confirm the observation. So it's all these different things that you want to look at. And remember time, you want to be as efficient as you can. Right? So this is pretty much, if you look at the line of gravity or true north, you can see that, you want almost all of those points to be relatively in line. So let me use my laser. All these points to be relatively in line so that you can see, right? Now, if you look at front to back, okay, maybe they have an element of kyphosis or lordosis. Maybe they're quite straight and the spine follows the normal curvature. You'll be able to see, even if you look at like leg development, maybe you'll notice that the individual has huge quads, but then there's no hamstrings. Or maybe they have these huge hamstrings, but then there's no quad. So you can really think of when you going to program, maybe you're going to do slightly more. If they have huge hamstrings and not balanced quads, maybe you'll do more quad, or maybe you'll do more hamstring. Or here, if you look at the back, maybe you'll be able to steer right. We need to bring this out a little bit, or whatever the case may be. Now, pre-test instructions, the following instructions should be provided to the client. Wear tight clothing. If it is female, preferably shorts and a strappy top. For a male, shorts without a shirt is more ideal. Again, please use discretion and make sure you get consent. Remove shoes and socks and stand comfortably with arms next to the sides. Do not tell the client that you are looking for what you are looking for initially, as they will try to correct their posture. Ideally, one can take a photograph with the client's consent, of course, of all four views, which can be referred to in the future to determine improvements. Now, it is important to explain to the client the benefits of posture analysis and what one has observed at the end of the posture analysis, as it can be quite an uncomfortable experience for the client. But if they understand what one is doing and why they do it, can bring some relief. Okay, so you need to think of that and make sure the client is always informed and feels comfortable at all times. Now, performing a postural analysis, are the earlobes level? So if you're looking front on, are the earlobes level? If the lower earlobe could have, if not, the lower earlobe could have a tight upper trapezius. So, you could have tight upper traps, or a sternocleidomastoid and or the scalene muscle, which will need to be stretched. So one side could be more stretched than the other, leaning like this, because then they're not equal. Are the shoulders level? If not, the higher shoulder could have a tighter upper trap or levitated scapulae. However, it is normal for the dominant side shoulder to be a little bit lower due to the ligaments and capsule being slightly more lax. Are the iliac crest level? If not, it could be a possible length discrepancy, or it could be due to a shortened quadratus lumborum on the side of the iliac crest is higher, or it could have been due to a large fall, which resulted in an upslip in the pelvis, or it could be as a result of scoliosis. So you see what I mean? It's not just about, are they level? Why are they not level? Okay, are they level? Then cool. Then you know that they are, have an element of progression. So it's all these different things which you can take from posture. Is the spine straight? By palpitating along the spine from the top to the bottom, one can determine whether there is a scoliotic curve or not. Are the scapulae flat against the thoracic wall? If not, it could either be pseudo winging, so the inferior angle is elevated of the scapulae, which is due to weak lower trapezius, and the tight pelvic type pec, sorry, pec minor, or it could be due to true wing. So the medial border of the scapula is elevated, which is due to an overactive rhomboid and weak serratus anterior. So are the greater truncatus level? If not, it could be due to a leg length discrepancy. Is the ear and eye in the same level? If not, it could be due to a slight elevation of the chin. So all of these, again, and I've put all of these here for you to think, for you to look at these things. For example, does the spine have a normal S curve? Is the thoracic region perhaps too flat, or the thoracic region is too rounded? For example, kyphosis. Or is the cervical region's curve more pronounced, forward head? Does the plumb line run through the middle of the shoulder? And all of these other ones that come in. What does the lumbar curve like, with the ASIS and the PSIS. Does the plumb line run through the greater truncata and the knee? Does the plumb line run just slightly anterior to the lateral malleolus? All these things matter. And the only way you are going to be able to point these things out efficiently and do a plumb line test, a plumb line test, all of these things you're going to take a look at afterwards, right? And you're going to do a proper analysis. You maybe going to take the photos home, upload them onto your laptop, um, and then maybe use a drawing tool or whatever the case may be to highlight different discrepancies, and then you're going to take that into the performance space, and then you're going to be able to give them adequate feedback. So you could either do a Zoom call, a Teams call, a WhatsApp call, whatever, send them the photos, be like, right, here's the write-up, what I've seen, etc. This is your imbalances, the two balances, and you're adding that overall quality, guys. This is where you gain that trust from your client. You don't gain the trust from the client further down the line when you've been working for a month, 2, 3. Granted, you will develop more of that relationship trust, but in terms of their trust in putting their health in your hands, this is where you start off the testing. This is where you show them that you take your job seriously, that you are not just like any other personal trainer, that you are a health practitioner, that you do care about things outside of just getting a paycheck from putting them through a workout, making them feel tired, and sending them on their way. Here you are constructing a plan that is not just about lifting weight, but is about reaching an end goal, changing their life, taking them from A to B or A to Z, whatever the case may be. And this is where your efficiency within this will be able to enable you to increase your service offering. So, from a financial point of view, the better your service, the more an individual can rationalize why they are paying you more than another trainer. The more poor your service, the more that individual is going to rationalize why they should maybe pay you less or maybe not use you at all. So it's all dependent on how you rate your service and the professionalism that you come across. with it. Now, this is not saying that now everyone needs to go and buy the brand new camera that is going to take the photos in 8K and you're going to upload it in such a way. No, this is just merely about service delivery, the quality of service delivery for your clients, the quality of service delivery of your service to them, right? It can be on a piece of paper and you can write it. But if there's an element of professionalism, there's an element of passion towards work, an element of legibility, I can guarantee you that the carryover to the buy-in of your clients, to the quality of your service, to the quality of the amount that you're able to charge for your service will only naturally increase. So think about that, guys. Now, when we look at body composition, again, the same rules apply, guys, here is please take things into consideration. Now, you can see there's 1, 2, 3, 4, 5, 6, all of these different things. Okay, maybe not so much the bioelectrical impedance because that not many people will be able to do, but all these skin, girth, waist, waist to hip, BMI, right? Use an element of common sense, please. When you're looking at doing these things, not everyone is going to be comfortable for you to wrap a tape measure around their stomach, right? If not, cool, move on to the next one. You're also not going to have time to do all of this. That's why majority of the time people use BMI. Yes, is BMI slightly outdated? Yes, very much so. But at the same time, it is still a measuring tool. You don't necessarily have to use it and put people in that category which BMI tends to put individuals into. Now, that is just more just the way that things go. But if you have BMI, you can use it if your BMI is high, if your BMI is low. Is your BMI changing over time? It could be an indication of losing weight because your height isn't necessarily going to change now, is it? So if your height is not changing, then weight must be changing for that variable to change. So if it's increasing, the weight must be increasing. If it's decreasing, weight must be decreasing. So you can use it as that variable to just keep showing your clients so that it's not just the good old, let's just look at the scale. Well, if your weight is dropping, then these different factors change. So then when you give them their feedback, or when you're changing their plan, or when you're having your touch base, your check-ins, whatever the case may be, you can start to show them that the variables are having a further transcending effect into their life. So it's not just about here, it moves into their overall performance. And then you can start to ask me, have you felt a change here? Have you felt a change there? But if you do not measure, if you do not show them the value in all of this, how do you expect them to know it? How do you expect them to buy into what you want to achieve, what the service you want to provide? And that is the mere importance, the very, very importance behind your service offering. And here, if we look at BMI here, so the body composition, the body mass index, right, also called the Quetelet index, is used to assess weight relative to the height. It is a measure of leanness. It is calculated by dividing the body weight in kilograms by the height in meters squared. Now, that is not the whole thing squared. It is height divided by meters squared. The bottom number is squared. If you square the whole thing, you're going to get a wrong answer. Please, the bottom number is squared. So if you want to calculate that first, so 2 squared is 4, and let's say your height is 8, so it's going to be 8 divided by 4, which is 2. So then, that would be the number. So do you get what I'm trying to say here? So please make sure that you understand that. One of the major problems with the height or weight tables and the BMI is that both methodologies do not take into consideration whether the person is heavily muscled or overfat. So for example, I myself, I'm slightly shorter, but I'm more densely muscled. I'm shorter and stockier. And by being that, when I do my when I do my BMI, I'm here. I'm classed as obesity class 1 or pre-obesity, right? I am by no means overweight. I am by no means unhealthy, right? I'm an athlete. I'm a former sprinter, etc., rugby player, you name it. But I'm not obese. But that's where you use it you take it with a pinch of salt. So by no means, please, if you can see that your client is not obese, but they're bigger, then don't tell them that they're obese. Just use it as a point of measurement. Use it for yourself. Put it in there. Just be like the following tests that I've done, BMI, etc. Or when you guys are doing your practicals or whatnot, or you have to draw up a testing thing, you put BMI there. You're not going to put BMI there and you're going to have a half an hour conversation with your clients about whether they're potentially obese or not, or whether they're potentially underweight or not. Please use it as such a tool, right? You want to use a lot of tools that can quantify performance, but that can further quantify progression. And and then you look at that for overall neurological buy-in. The brain looks for patterns. If you can show the individual that things are working, and it's not always about weight. If you can show them multiple different variables that they are improving or that things are changing, you're going to increase their buy-in. But if you keep showing them weight, what happens on a week when the weight stagnates? Does that mean that you've had a bad week? Maybe. Maybe not. But if you have multiple variables, you'll be able to be a lot more effective, a lot more accurate with your feedback within that. And then you can take it from there. But for means of explanation, here are some of the categories which BMI gets broken down into. We look at the waist to hip ratio, is used to identify individuals at risk for potential disease. You can see here are, the various different waist to hip ratios. These are relatively inexpensive and simple. And to calculate the waist to hip ratio, it is the circumference of the waist divided by the circumference of the hips. Now, the waist is different to the hips. The waist, you're looking at roughly um, around the belly button. And then here, the waist is measured at the narrowest part of the trunk above the umbilicus and below the xiphoid process, and the hip is measured at the maximal circumference of the hip buttocks region. So the hips will be lower, the waist will be higher, right? And again, use discretion. If an individual doesn't want you wrapping a tape measure around, don't. You've done BMI for argument's sake, or you've done one of the other ones, and then you can move forward. But also be knowledgeable of the length of your tape measure. You don't want to be in a situation whereby you're trying to measure someone and the tape measure is too small, because it can happen. And then again, you don't want to go through that awkward process. So please just use that, and then you calculate it, and then you get your answer, and then you can cross-check that with the table to then see, and in which what you call it, in which range do they fall for the hip to waist ratio. Now, if we look at the waist circumferences, given that the risk of problems mentioned above are associated with abdominal obesity, the following waist circumferences can be classified as high risk. So, for example, if you look at men, if they're 102 centimeters, that is potentially high risk. It's important to remember that during weight reduction programs, the size of the fat cell may decrease, but the number does not. We've discussed that before with regards to nutrition. Now, if you look at girth measurements, so this is merely just, using the tape measure. You measure the chest, the abdomen, the waist, the upper arm, the forearm, the hips, the thigh, the calf. And then you can see, you can also use this, it's not just about weight, it's about muscular size. If you want someone, they want to grow their chest, you measure around their chest. If that number grows, well, then there must be an increase in muscle mass. The same with the abdomen. If they want to lose weight and they want to feel leaner, you know, if they are losing weight, then that number should decrease. So this is my point again, is that it doesn't always have to be weight related. Because remember, weight is also linked to, for example, density of muscle. If your muscle weighs more than fat. So if they are putting on more muscle, but they're equally losing fat, then they may increase in weight. So the scale can't be the only quantifiable variable that you use when gauging progression or performance. So here's many different ones that you can then do with regards to girth measurements. You measure them, please make sure that you use the same measurements, such as, for example, if you use centimeters, use centimeters. If you use millimeters, use millimeters. Use all of that unanimously throughout. Especially with the girth, because 1 minute you measure chest in centimeters, and then the next minute you measure abdomen in millimeters. Now all of a sudden you're trying to do cross calculations, etc. And yes, it is only 1 decimal point, but at the same time, that 1 decimal point could be quite a difference in time to come. Now, if you think of skin fold measurements, you get various different ones. You can get the smaller ones where you just measure 4, if I'm not mistaken, or you can get 6 and 8. Now, you use this with the caliper. HFPA, to my knowledge, does sell sets where you can get everything inclusive, your stethoscope, you can get your blood pressure cuff, you can get your skin fold measurements, you can get various different tools. So please check that with your tutor if you would like one. I'm not sure if they still are available. I do stand corrected if they do not, but please, you can always check with regards to HFPA or UXI for that as well, or you can also go and potentially buy your own. But if you're going to do skin fold, they do take time. You do have to practice. It is quite a touchy one, so you are going to be pulling the skin. You are going to be seeing the density of the various different skin folds. It is going to take practice, and it is going to um, involve, like I said, touching and measuring, and you want to try and be as accurate as possible. And again, when you open the caliper, so it's like a pair of scissors, but you open it and close it. I don't have my one on me now, whilst I'd show you. But when you open it, again, use discretion. If you're going to do the skin fold and you're going to go to grab someone's waistline or abdomen, and you're going to grab, and you can notice that the skin won't fit into the thing, into the caliper, don't try and force it. Again, it's just that awkward situation. Let's just be mindful of that. And again, you want to be as quick as possible, but efficient as possible. You move slow to move fast. Now, here's also further different measurements that you can take with regards to the body composition and taking the skin fold measurements and where you are going to take them. So, for example, here you have the suprailium, you have the subscapular, the medial calf, the mid-axilla, the chest. Here you also have the abdomen, the thigh, the triceps. So there's multiple different spots where you can do this. What you're going to do is to then calculate. You can use skin fold measurements to calculate body fat percentage, for example. And you take that and then you can type it into a body fat percentage calculator on Google. You can choose which one. That will say how many skin fold measurements did you do. You select which one, the body parts that you measured, and the the measurement from the caliper. So please make sure that the measurements that you're putting in are the same measurements on the caliper, or that the same measurements on the caliper are the same measurements, the units that you are typing in, to just ensure accuracy, or else you are going to get a skewed answer. Now, when we're looking now at the testing, so now we've done the screening parts and the resting assessments. Now, when we're going to go into the testing, you got to, when you look here, there's agility, flexibility, speed, power, strength, endurance, fitness. Now, we've already done heart rate, blood pressure, posture, and body composition. Now, when you look at that, let's say you just choose one of each. So you've already done four. If let's say you have an hour session with your client, you've already done four. There's a following one, two, three, four, five, six, seven. That's 11. But of the four, let's say that took a total of 15 minutes. You now only have 45 minutes left, of which you need to set up for these and measure them. And remember, if you're in a public gym and not your own gym or a private gym or whatever the case may be, if you are at like a Virgin Active, a Planet Fitness, there's going to be a lot of people. So you're probably going to have to clear up that one assessment, lay down a new assessment so that you can then test that one, because for the sense of space and efficiency. So, you know, maybe you're going to do it in a studio or whatever the case may be, but it still takes time to set everything up. So please make sure that you think of this logically. If you are going to be doing testing, for example, at a peak time, for example, 5 p.m., the work rush, people coming to gym after work, you be prepared that you may have to work in a smaller area. So then also make sure that the test that you are going to do cater for that. And the availability, sorry, of equipment, the availability of time, the availability of space, etc., is there. And just to make sure that your client is able to get the best service from you and that you are able to get the best service to yourself. Yes, I keep saying it's about the clients and making sure that they, etc., but it's about you being able to do your job effectively. If you're unable to do your job effectively, or you're feeling awkward because people are around you, it's busy, etc., you need to be calm, controlled, but competent and content that you know what you're doing, that you understand what you want to get out of it so that you can perform the best service possible. That is really all that you want to do, guys. Produce the best service possible. Now, let's look at fitness. So here you can do roughly 3 tests, guys. And why I say roughly 3 tests, we'll go through them, but you really just want to select one. You're not going to have a chance to do all of them. Now, you can do the 2.4 kilometer run test. Now, with these tests, common sense again. And you'll notice it's the overarching theme that I keep saying, common sense. Why do I say it, guys? Because you may think that, right, cool, I can strap them onto the treadmill or the sprinting machine. I'm just going to do the 2.4 kilometer run test and see how they're going to go. What if this person hasn't run before? So now you need to think, if we go back to the previous slide, the order in which you're going to do it. Now you're going to make them run here, but let's say under strength or power, you're going to make them squat. So you've just made them run 2.5 kilometers. They haven't run in their life. And now they're going to have jelly legs. And now you're going to ask them to load up to do a maximal squat. What about warming up? What about all these different things? So do you see what I'm saying? Whereby like you need to choose certain things or what's important. Maybe you're going to look at this and you're going to think, heck, I'm just going to do a fitness, endurance test, and maybe flexibility and agility because they just want to get fitter. They want to start running. They maybe want to, do all these marathons that everyone's doing now. So I'm going to select these. Maybe someone wants to be a high rocks athlete. So what you're going to look here? Maybe you're going to pick between fitness and endurance. You're maybe going to pick between strength and power. You're going to maybe pick a speed. Maybe is that relevant? Maybe, maybe not. And then a flexibility or an agility. So then you can pick those that which you want to do. Or maybe you're going to do a testing day today, and then you're going to do another testing day later on. Maybe they're more of a professional athlete. How are you going to cater it? You need to think outside of the box. You need to think, what does your client require to get to the goals where they want to go? If someone comes to you and be like, hey, how's it? I just want to get into high rocks and you want to test them. Well, then you take that, you do the testing that you think is going to give you the best answers to create the best program for your clients. Ideally, if you want to do all of them, then at least you can pick and choose. You can take it from a baseline test and you can do uh, this test every 3 months. You can be like, right, every 3 months, we're going to do a whole new testing to see what the progression is, right? Maybe once a month might be too soon for your protocols to get into them, for them to generate a response. So you got to gauge, you got to feel, you got to trust yourself, you got to understand what are you testing for. If you don't even know what you're testing for example, if we go here to the fitness and you're doing a 2.4 kilometer run test and you're doing that, what are you doing it for? Are you just doing it because it's a cool test to do? What is the information that you want to get out of it? And if you can't think that there's something valuable that you're getting out of it, then don't do the test. It's as simple as that. Why would you do the test if you are not going to get valuable information out of it? Because then now you're just wasting time. You could be doing something better. You maybe could have taken more time setting up something else. You could have maybe paid more attention to the blood pressure reading or whatever the case may be. So think about this, and I know that I may sound like I'm a broken record, but you have to think about your service. You have to think about the client. You have to think about what are they going to take away from this? Are they going to take away from, like I literally just spent now, I had a long day at work, and all that I've done now is just testing and more testing. But if they understand the value of it, they're going to be like, holy smokes, I now understand what I need to improve. It's all about how do you deliver your service and the passion, the the attention to detail and the reasoning behind why you're doing this. A lot of the time, people feel discontent because they don't know why you're doing something or the purpose behind it. If you can explain to them the purpose behind it, especially in your initial conversations with them, then you're A4 away, right? So back to the test. If you look at the 2.4 kilometer run test, what do you want to get out of it? If you have the 9 or 12 minute run test, you make them run for 9 or 12 minutes, you're getting from there. Or you get the different treadmill tests. You get the Bruce treadmill protocol, the multi-stage maximal treadmill protocol, and the single-stage sub-maximal treadmill walking test. Arguably, the treadmill tests are probably going to be the easiest one to do. Why? Because out of equipment in the gym, there's a million treadmills, right? In most gyms. So probably stick to that. You can practice on them, you can test them, you can test the protocols on your own. Where the 2.4 kilometer run test, where you're going to find 2.5 kilometers for them to run. Is your gym maybe, for example, if you think of Gold's Gym in Sandton, that's more in very much a residential area, complex block kind of thing. You know, is there somewhere for them to run? Maybe. If you think of Planet Fitness, some of them have tracks inside. Maybe then, yeah, you can do a 2.4 kilometer run test. Have you measured the track? Is the track measured accurately? Does it say 400 meters for argument's sake, or 200 meters, but it's actually not 200 meters? It's actually 210 meters, or it's actually 190 meters. Now you think it's 200 meters, but in actual fact, it's more or less, or whatever the case may be. So these are the things you need to take into consideration before you do the test. Now, if we move over to endurance, yeah, these are slightly more easy. Now, you're going to look at the 2-minute sit-up test, or the partial curl-up test, or the 1-minute push-up test, or the YMCA bench press test. So a lot of these that you can get done quite quickly is like a 2-minute sit-up test. You make sure they warm up, you get a nice mat, you hold their feet, you set a timer for 2 minutes, go do sit-ups. Right? How many can they do in 2 minutes? It's 120 seconds of hull, and they're A to go, and you get a reading. You look at the 1-minute push-up test, the same thing. You help them set up. You make sure that you put your fist or whatever to make sure that they go down, they touch, and they go up, or you put a marker or something that you put there, or a little block, to make sure that they meet the same depth every single time. And make sure that they complete a push-up. It's not just going, it's all the way down, all the way up, lockout, all the way down, all the way up, lockout, and make sure that they complete the test accurately. And you'll notice if they do the test accurately, you'll be able to get better accurate responses. You'll be able to get better buy-in from them when they're doing their training because you've done accurate testing. And in time, that accurate testing will just result in better variables that come of it. And that's what's also really cool is because in time you'll do all these tests at the beginning and think, oh my gosh, like this is just so annoying. But imagine 3 months down the line when you can take a client through a progress report and you can say, back in the beginning for the 2-minute sit-up test, you did 30 sit-ups. Now you're doing 45, or you're doing 60, or you're doing 100, whatever the case may be, and they can see that progression so they can further buy into your service. They can be like, holy smokes, you took me from here to here. Before I wasn't able to do this, now I'm able to do this. And that's what's so beautiful is you are directly impacting these individuals' lives. You are changing people's lives. You're making them healthier, giving them a greater life expectancy. You are making them a better asset to themselves and to the people around them. You are changing the world. You're definitely changing their world. And subsequently, the more people's worlds that you change, changes the overall landscape of the world entirely. So you are changing the world. You do have value. What you're doing does have value, but you have to be able to see that. You have to be able to understand what you are doing to see that value, to get to that point where you can look back with that progress. And then you have the YMCA bench press test. Now, here you need to set up a bench press. If you are in your more commercial gyms, Virgin Active, Planet Fitness, etc., is a bench press available? Does the individual know how to bench press? The weight required to do that, etc., etc. So, if you do want to do it, you can get the YMCA bench press test on your phone, and you can play it. Um, it is merely just doing bench press, but within a constant um, frequency. So it will go doot, 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 and we'll keep that same, and we'll see how long you can do that for, or the frequency will change. And I think it starts slower and then it gets faster. So you can see how many reps you end up doing and you count, etc. And there's a very different, like a weight, a percentage of your 1 rep max, etc. I think it's 60% or 40% of your 1 rep max. Um, and that's what you work with. So, there are various different ways, but mainly I think the majority of the ones, if you are going to do an endurance one, these are the ones that I put here. There are probably many, many more that you can use. Now, from a strength point of view, right? Muscular strength and endurance tests are also important as one can again confirm observations made in the posture analysis. If a muscle is overactive, Is that the muscle tight and strong, or is it tight and weak? For example, one may observe an individual with forwardly translated shoulders. However, after performing a 2-minute push-up test, one may realize that the muscular endurance of the pectoralis is in fact weak despite their hyperactivity. Performing muscular endurance tests with the posture analysis provides the exercise specialist or the personal trainer with further pieces to the puzzle in order to design a more individualized rehabilitation program. So, for example, some of these tests, if you're going to do strength, you can do a partial curl-up test, a push-up test, a YMCA, a 1-rep max bench press or back squat. Now, when you're thinking of these strength tests, think of setting up, warming up. You're not just going to set up a 1-rep max bench press and they're going to go in there and they're going to do 1 rep. You're going to help them warm up because you don't want them to injure themselves. So is the bench press available when you want to do it? Is there time to warm up? Is there not time? All these things play a role because now you need to think of where are you going to put this in? So, for example, if you're going to decide to do a 1-rep max bench press, but you just put them through a 1-minute, excuse me, push-up test, if you think of it like that, then what result are you exactly going to get out? Are you going to get an accurate result? One would say possibly not. Why? Because how are you going to be able to get an accurate result if they are tired or they're fatigued? Does that put them at risk of injury? Probably. But then you're also just wasting time because you're not getting accurate results. So please do consider these various tests and how you want to do it. The same with the back squat. Are you just going to load up 4 or 5 plates and you're going to be like, hoorah? And if you get in the hole, sucks to be you. Do they know how to squat? Have you seen their squat before? All these different things play a role. And when you do this, you want to do it with a free weight. You don't really want to do it on a split machine because of that carryover. So there's a lot of different variables that come with testing it, and you want to just be able to give the best service, as I've mentioned multiple times. So you really do want to think of that and be able to take that forward in as best a way as possible. Now, when we look at power, you can do a standing long jump test, where the lower body can be assessed during the standing long jump. The client should line up behind the starting line that is attached to a 3-meter long tape measure that is stretched out in front of the client. The client starts to jump as far as they can. A counter movement is allowed, so you can go down and up. The client is asked to jump as far as they can, and the client should land on both feet. The measurement is taken at the back foot that is closest to the starting line, and the best of 3 trials is recorded to the nearest centimeter. So you're going to give them 3 tries. You can potentially do this. You can do this in a studio, or you can set it up. You grab a little bit of tape, you tape the tape measure down, or you grab a ruler, or whatever the case may be, or you can potentially do it on some gyms have like a 10-meter stretch where they use like the sled push or something, and those are 10 meters. So you can just ask them to stand on 0 and jump. You could also use that. You can measure it. And these are just to see the power, the force production um, through their body to be able to jump. Really good test, really relatively easy to set up if you do have that sled push area. Arguably, you don't even really need to set it up because even if you can't stand at the 0, you can stand at the 2 and take 2 as 0, and then they jump to 3, and that is 1. You know, so you really can generate quite a nice one here. You can also do a vertical jump test. I'm not sure if any of you guys follow like American football or anything like that. You can see this a lot how when they in their preseason they're doing all these different tests, and they go and they jump and they tap. Now, when you do the vertical jump test, what you do is you first want them to stand against the wall or against and see where their fingers are going to touch, right? So you're going to see they're going to touch there, and then they're going to jump, and then they're going to slap. That vertical jump is the distance between the two. It's not from the ground all the way to where they jump up, and now all of a sudden they have a vertical jump test score of 3 meters. No, they'll have it of a couple of centimeters if they jumping more than a meter, I mean, that is very, very impressive. But the point being is that you want to measure here, and then they're going to jump, and they're going to tap. So you measure the distance between the two marks, um, especially with the dominant hand, and that's what you really want to measure. And see, if they're over a meter, they are able to generate a lot of force, and then you're able to gauge that. And that's also where it's pretty cool is after a while, if the individuals lost a little bit of weight, they've gained a little bit of muscle, they're a lot fitter, they're a lot stronger. All of a sudden, all these scores are going to change, and you're going to be able to see literal performance before your eyes, not just all about the Instagram, the body composition, the losing weight, the abs, the muscles, etc., but the actual performance side of the individual. Now, when we look at another power exercise, you can also look at a 1 rep power clean test. Here you instruct the athlete to do a power clean test. This is located in chapter 15 of the textbook, if you do go through that. Warm-up sets are performed and load increments are selected, as for example with the 1 rep max bench press. And that's what I'm saying is that you've got to take time into consideration because all these things do take time, and the time that it takes to set and warm up, etc., needs to be taken into consideration. But if the individual comes to you and let's say they want to do CrossFit, or they want to do bodybuilding, or they want to do powerlifting or whatnot, then you probably may take the time to do these 1 rep max bench press or squat or whatever, because you're going to get more information that is specific to the client out of doing that, right? Because then you can cater for their plan by knowing how much they can lift, so then you can do the accurate percentages of their 1 rep max with regards to programming and assessing, or at least give them a ballpark number to shoot for, you know, because if someone's never trained before, um, you're not necessarily within that because they're going to naturally increase their strength quite well. But if you're dealing with someone who's more specific and they know where they want to go, what they want to do, how they want to do it, then maybe you're going to end up having a slightly more in-depth approach. But that is based on you as a trainer, and you can take it accordingly. Now, when we look at speed, if you think of Lightning McQueen, speed, or if there's any fans of Top Gun, when Maverick says to Goose, I got the need for speed. Right? It's pretty cool line, sorry for my nerdiness there. But when we look at the sprint ability, it is an important factor for most sports, for most individuals. So you set out a 20-meter distance. You can get them to travel in short bursts, and due to this, you then now need to think carefully now. Like if you're doing this in a gym, where are you going to find 37 meters? Because you can do the 40-yard sprint test, which is 37 meters. Where's start and where's the end? That's also what's going to be quite tricky. And when you think of that, um, where's the start and where's the end, it's going to be very difficult to try and gauge, that accuracy and how you're going to measure the 37 meters. Now you're doing it in the gym. People are trying to walk. Now you're trying to tell people to wait. Maybe your client feels a little bit overwhelmed. But ideally a field, or like I said, in some gyms, they do have an athletics ring around the gym. It will, of course, be quite small, but maybe there'll be a stretch that is around 40 or 50 meters straight. So then you can have your 37 meters for them to go. And then you just literally measure the time. And you get them to do their 3 or 4 point stance to start. And then you just measure the time given with the 2 trials or 3 trials. And you give an average, and then you can say, right, okay, cool, this is your sprint time, this is your speed, and then you just get it to go again and again and again in times to come, and you can just see if that speed is going to increase. If they get more power, more muscle, more speed, more flexibility, more agility, then they're going to be able to run faster. You'll be able to analyze their biomechanics. You'll be able to analyze their overall performance, and thus you'll be able to intervene where necessary to increase that performance. Now, when we move on to flexibility, A thorough assessment of flexibility can aid in injury prevention, right? Flexibility tests are covered throughout the chapters in your book, and a flexibility test can often confirm observations made in the posture analysis. For example, one may have observed a severe anterior pelvic tilt and lumbar lordosis. This client will probably also have bad skin distraction score, therefore an improvement in the skin distraction test with the teaching the client to find a pelvic neutral. One should see an improvement in the standing posture after exercise intervention. The importance of these tests should not be underestimated. So what we're saying here is when you look at flexibility, you'll be able to gauge, various injury prevention. For example, if they are not flexible with certain movements, you will then be able to dictate what training protocol they should do. Because if you, for example, give them an exercise that requires a lot of flexibility, let's say you're going to do a hack squat and they're going to try and go all the way down because you're telling them, no, you got to go as low as possible, but they don't have the flexibility to do that as such, for argument's sake, then you may be putting them at a risk of injury because they're going to try and follow your plan to the T. And now you're telling them to go as low as possible, but you know that they don't have flexibility. And then all of a sudden you're getting a phone call from your client to say, by the way, I'm booked off for a month or two because I've torn my hamstring or whatever the case may be. And now you need to start at square one because now you need to do a rehabilitation protocol for them. You need to, et cetera, et cetera. So, you do get a lot of this, and you will also then be able to know, okay, cool, maybe you need to do a lot more mobility training, but you don't know if you don't measure. So the tests that you can do are like a goniometer test. Now, a goniometer is like a very big protractor. It's like a human protractor. It's huge. Again, if I had mine, I would show you. But it's packed away somewhere in my bag. And you have this huge, almost like protractor. Like if you remember with maths, you got your little math set, and you can then see the flexibility of your knees, of your joints. You can put your arm out. You can see the flexibility of your arm. You can put your knee out. You can see the flexibility of your knee, and you can gauge all of that. And then you'll be able to see what tests you should be able to do. If you don't have one of those, you can do, for example, just a normal sit and reach test. You can see what's the flexibility of the hamstrings, the lower back, your pelvis, etc. The sit and reach test. So you set it up, and then they lean forward, and then they touch, and then you measure the distance. All of these should be in your textbook um, under assessment and testing um, or assessment and programming, sorry. And there's a lot of crossover benefits regarding that, because uh, a flexible muscle is a strong muscle, right? And an element of flexibility comes with tendons, etc., and just mobility within that. Because if you just keep training within a short range of motion, now I'm not trying to get on this whole science versus anecdotal evidence of range of motion, etc. You train within a range of motion and you prescribe a range of motion that you feel fit for yourself and for your clients. Different clients will require different ranges of motion. Different clients will require different attention to detail. Some people will train slightly differently within what feels comfortable to them, etc., etc. So when it comes to flexibility, this is not to tell people, necessarily how they should or shouldn't train, but rather just to give them insight into their overall flexibility with regards to performance. And from there, you can try and educate your clients to the best of your ability with regards to what you are trying to see and the carryover of what you want to see. But overall, if they can feel the muscle and there's that mind muscle connection, I would always say mind muscle connection over scientific literature. And what I mean by that is I would always go with what the brain can feel and what the body can feel before you try and put this individual not in a box, but you compare them to what science says, because you are going to have those outliers. And remember, science is only based on the individuals that the testing was done on. Now, we can take a lot of value out of that and a lot of value out of research, but you have to be careful with what you take. And a lot of the time, people often cherry pick what suits them, and then you don't really get the overall view of the research. So please, whatever it's going to be, whatever your stance is going to be, make sure that you feel confident in that stance, but that you're able to understand your client and your client is able to understand you. Now, when we look at agility, You can do the various different agility tests, but to understand agility, it is a measure of how quickly direction um, can be changed without losing balance. It can be seen as a key component in offensive and defensive play if you're looking at sports, and performance in agility depends on a number of factors such as strength, flexibility, power, and reaction time, etc. Especially the brain. Here you're looking at very different tests. And when you're looking at agility, the one test that you can do is the 20-yard shuttle test. Can be assessed where you lay this out. Again, you are going to need a big space because 20 yards is roughly 18.3 meters. And and here they're going to be listening to sound, and they're going to be sprinting, and you're going to be asking them to go forward and back, for example, to the mark and back, and then you're going to be testing times or forward and right, and we're going to look at, for example, like the T test, and they're going to be running forward to the middle point, then right or left, depending on what you shout. And seeing their agility to change at that given moment in time. And you're going to be like, okay, go. They're going to run to the forward, and you're going to go left, and then they're going to go all the way left, and then all the way to the right, and then back and forward, or whatever the case may be. So there's all these different things that really need to be taken into account well, with testing. But agility is kind of tying everything together. And then the T test, which I just explained, this one is probably going to be more, I don't want to say feasible, but easier, because if you do have a studio at the gym, you can just quickly set it up, and you just literally you need 5 meters, literally. So you're going to have 10 meters from the middle cone to the top of the tee, and then you're going to have 5 meters either side. So you can pretty much set that up in most gyms. If you do it relatively quickly, you get a cone, or whatever the case may be, or a block, and you set it up, and then they can conduct the test. Now, conducting the test, you really just want to try and get an overall sense of the individual's agility. And then over time, you can work on these different things and then give them different exercises to improve it. But the T test is definitely one of them. And then you also get the hexagon test. These can be a lot of fun if you have an outside area with your gym or space, or if it's quiet and you're able to do this. These can be a lot of fun. And you do the hexagon, and then you can get them to go in a clockwise direction, or you get the different colors. And then all of a sudden you can do front cone, back cone, left cone, right cone, top left, or whatever. So if you have the 6 vertices, so you can have top, bottom, or front and back, then top right, top left, bottom left, or whatever the case may be. And then you can also get to a point where you can start have them in the middle, and you can go top right, top left, forward, and you can start to really play with it, and you can start to see their overall reaction with it. So there's a lot of ways in which you can test agility, guys, and that's the fun part. You can come up with your own ways, etc. You can use the textbook as a guide, as long as you know what you are getting out of it. And that's really where we are. And then from there, you get the components of exercise, whereby specifically you want to look at the warm up and the cool down. And this is very specific with regards to the screening and testing. Why? Because we often neglect this. We often take our clients straight from there, we go straight into an exercise, and that's where injury occurs. And you're not going to get accurate results because there's not enough blood in the body, and when there's not enough blood in the body or in the joints or whatever. Of course, there's enough blood in the body, sorry, excuse me, but not in the joints. You know, they're not going to be as flexible, they're not going to be as movable, not going to be as warmed up, and the performance will suffer. So again, you're not going to be getting that accurate response that you maybe want. So please take that into account. Please think about that before you do that. And then the same with the cool down. After you've done this, spend 5 minutes, get them to cool down on a treadmill, get them to just warm down, stretch, and ensure that they understand the value of warming up and cooling down from the get-go. If you're emphasizing warming up and cooling down in the testing, and then you put that into their program, they'll be able to see the carryover of the importance. It's going to improve performance, it's going to improve recovery. And yes, it's probably something that we all probably don't do. I hope we all warm up, but probably I'm also bad at cooling down. But warming up is incredibly, incredibly, incredibly important. And then the cool down, I just noticed that I put the wrong things on either side. Um, but warming up is very, very important for functioning point of view, and then the cool down for injury prevention point of view. So those are the things that I want you guys to think about with regards to the assessments and screening. You can see that there's a hell of a lot, especially if we go back to the very beginning. You know, if you're looking at, for example, here, body composition, if you're looking at, again, um, underneath the screenings, you can see how much time it's going to take to do all of this. I mean, here we are, and I've been talking for over an hour and a half. And that's just talking through, never mind doing it. So it's going to take a lot of practice, guys. It really is, but you can do it. And it's the same when it comes to all the other testing. Um, when you do have the testing, for example, here, you can see the fitness and endurance. Um, you got to do all of these testings, and the body composition is the same. You got all these body compositions, you got all these testings um, that you want to do. Just make sure that you pride yourself on your service, that you are able to give the best service possible, and that you yourself can carry over that value of what you're going to do. You don't have to do everything, guys. Sometimes less is more in this space. You also don't want your client to be overtired. There's only so much that they can do within that space and time. So please do be diligent. Please practice. Please spend time in the content and making sure that you guys become the best trainers, the best specialists, the best strength and conditioning coaches, whatever the case may be, the best health practitioners that you can possibly be. Because I believe in you guys. You guys genuinely can change people's lives, but you got to know what you are doing. You have to pride yourself on the knowledge and the skill set that you're going to require. It's great to know theoretically what you're doing, but you also need to understand the practical components and vice versa. It's great to know all the practical components, but you need to know the theory behind it and why you are doing what you are doing to add that value and that service. So, thank you so much for listening to me today. Thank you so much for the lecture. If you guys have any questions, please do ask your tutors. Please spend time on your work. And if there's anything that you do need from me, if you'd like the lecture slides or whatever the case may be, please pop me an email and I'll send them over to you. But thank you so much. Have a great Saturday. Enjoy your Starbucks, your Seattle, your Vada, Woolworths, whatever the case may be. Have a great weekend, guys. Prioritize your health, prioritize your clients, and believe in yourself, for I believe in you. Thank you so much. And I'll see you guys in the next one.